Hi, everybody. Good morning. Happy Cinco de Mayo. We will get started in about a minute or two as we just wait a moment for folks to move from the waiting room into the main session. Thanks for being here. Hi there. If you're just joining, we're just waiting a little bit before we get started to transition from the waiting room to the main session. So thanks for being here. All right. I think we will go ahead and get started. Happy Tuesday. Happy Cinco de Mayo. My name is Sohail Sood. I have the honor of serving as director of California's Children and Youth Behavioral Health Initiative, and I want to welcome you to this final webinar of a four-part series called Transforming Together. We can jump to the next slide here. Over the course of this initiative, I've had the good honor of meeting with administrators in various parts of the state, including over the last few weeks, and I would delightfully say that the questions we have collectively been facing have been transitioning, in my opinion, from how do we do this work? How do we support our young people with effective services and supports to how do we do this work together? Right? How do we coordinate across our various agencies and institutions to do this work more effectively, to do this work more efficiently? And that's really what we're here to discuss. So that's the goal of Transforming Together. This series really aligns with also a written guide that has been developed in 4 chapters. And so if you've joined us for the past webinars, you'll see that the focus has aligned to that guide of providing implementation support to create this statewide ecosystem. It started with the goal of understanding models of shared leadership, and then has transitioned to talking about shared goals, about centering youth and families, to coordinate services, including with a coordinated workforce. And today we focus on that ever important topic of sustainability. We can jump to the next slide. So we've got a great session today featuring many fantastic speakers. We're going to use the Q&A feature. So please feel free to ask any questions you have in the Q&A, and there'll be time reserved at the end where those submitted questions will be addressed. Lots of resources and links will be put in the chat, so feel free to keep that open to receive information. But again, most of the interaction is going to happen with the Q&A box. And we can jump to the next slide here. So I'm delighted to be joined by stellar folks doing great work and providing great insights into the concepts that we're going to share today. Joining me is James Soward from the San Bernardino County Superintendent of Schools team, Elizabeth Estes, who's the Director of Breaking Barriers, Jason Willis, Clinical Professor of Public Policy at the McGeorge School of Law at the University of Pacific, Peter Stoll, Director of Prevention and Intervention Services at the Humboldt County Office of Education, and Michael Lombardo, who serves as a senior advisor to us in human services and health and human services, as well as to many educational agencies across the state. And so with that, I will hand it over to our MC and fantastic partner, Mr. James Soward, to take it from here. Thanks again.
Thank you, Sohail, for that. And good morning, everyone, and certainly appreciate you all being here. As Sohail said, this is our fourth and final session in the Transforming Together series. And today we're going to focus on something that I think, as Sohail said, everyone is on everyone's mind, right? How do we actually sustain this work over time? We've spent the last few sessions building shared leadership, shared goals, and coordinated service model. Today, it's about what happens after that, right? And so, Jameen, we go to the next slide. Who this is for, right? So as always, this space is intentionally cross-sector. We have folks from behavioral health, child welfare, probation, public health, education, community-based organizations. And that matters because sustainability is not owned by just one system. It's something that has to be built across systems, right? And ultimately, families don't experience sustainability as a funding concept. They experience it as consistency, access, and trust. Okay, go to the next slide. So just to ground us, we started with, again, shared leadership, which is our chapter 1, then shared goals and centering youth and families in our chapter 2, and then the universal array and coordinated workforce was our chapter 3 and our third session here. And now we're here. How do we sustain all of that? Because the reality is alignment without sustainability doesn't last. Okay. So we certainly want to keep that in mind as we move throughout the day, just as or through this morning around in order for us to sustain the shared leadership, the shared goals, and the universal array, we have to align in a way that all systems become one system. And so I'm going to pass the mic over to Miss Elizabeth Estes now. Thank you all.
Hi, everybody. Good morning. Excited to be here. Thanks for being here with us. Today, we're going to be talking in the fourth webinar of the series about sustainability, which is, I think, as we all know, just critically important to the work, because not only do we need to build integrated, coherent systems and ecosystems, we need to be able to sustain them. So we're going to spend the next hour here really talking about the why, what, and how of sustaining an ecosystem of care through really 4 pillars that we've outlined in chapter 4, integrated financing, continuous quality improvement, community-defined data ethics, and reciprocal accountability. And we're going to talk in more detail about what that is. Before we begin, I just want to acknowledge that this work is complex. It actually is transformational work. It does require shifts in how systems operate, how we think, how we partner, and that takes time. So we're not expected to walk away from this webinar series having finished the work. This is ongoing work and a new way of operating our systems into united ecosystem. And so this is really about giving a roadmap and then doing the work on the ground. We want to be thinking through the session about whether these structures exist in your systems in the field, how developed they are today, and how you might begin doing the work. And then we're going to hear from Humboldt about the work that they're doing to sustain their integrated system development in Humboldt. And then at the end, we're going to have Q&A and discussion questions as we have in all of the webinars so that you can ask your questions. So certainly be thinking about those and put those in the Q&A section. You can go to the next slide. When you go to the guide, there are 4 interdependent practices of sustainability that we've put in: the integrated financing, continuous quality improvement, ongoing community-defined data ethics and info sharing, and ongoing reciprocal accountability. And each one has its own section in the guide, and each one we're going to be talking about independently here today. So we just want to talk a minute, you can go to the next slide, about the why of these 4 interdependent, functionally and operationally defined factors for sustainability and bodies of work. So why should we be building all of these? And I'm going to turn it over to James to talk about the why.
Thank you, Elizabeth. So before we talk about the tools or strategies we have to be honest about the challenge, we have to be honest about the challenge because most systems are not struggling with ideas, they're actually struggling with sustainability, right? So as we're having this, we're thinking of this, that's what we want to be considering. What we're typically seeing is a cycle, right? What we usually see is a cycle. So pilot, short-term funding cliff, right? So programs get launched, they show promise, and then funding runs out, priorities shift, or systems move on. And what that creates is instability for staff, inconsistency for families, and systems that stay reactive instead of proactive, right? We go to the next slide. So when we talk about sustainability, we're really talking about financing. Right now, funding is fragmented, it's tied to rules, not outcomes, and systems are incentivized to protect their own resources. So what integrated financing does is shift that, right, from isolated funding streams to a shared investment in outcomes. So now resources follow children, they follow families, and they also follow the need, right, and not systems. Let's go to the next slide. So even when funding is aligned, systems still drift, right? Because systems are shaped by daily decisions, staffing choices, and how we interpret data, right? So continuous quality improvement is what keeps systems aligned over time. It's not a one-time effort. It's actually a discipline, right? So where this discipline is where data is used for learning, youth and families are a part of the process, and systems adjust in real time. Okay, so we go to the next slide. So why ongoing community defined data ethics and information sharing? Why data ethics and information sharing? This is a big one because data is not neutral. Okay, it can reinforce inequities, create mistrust, or miss the full picture of a child's experience. Right now, most systems operate with multiple plans, multiple data systems, and incomplete views. The shift here is towards one child, one plan, okay? Where data is shared responsibly, privacy is protected, and families are a part of the conversation. Jermaine, we go to the next slide. So why reciprocal accountability? Right now, accountability is siloed. Each system has its own dashboard. Education looks at one thing, behavioral health another, probation something else, but no one is looking at the whole child experience, right? Reciprocal accountability shifts that. It says we are collectively responsible for outcomes. So as a one system, we're collectively accountable and responsible. Not just outputs, but safety, connection, well-being, and equity. So when you put all this together, sustainability is not just about funding, it's about how systems operate, how decisions are made, how data is used, and how responsibility is shared. Okay. Elizabeth, I'm turning back to you.
Thanks. Okay, so we're going to talk now about the what of this work. So we can go to the next slide. What are we saying when we mean integrated financing? So when we go into the guide, we have a lot more detail. But really what we're talking about is cross-agency practices and agreements that intentionally blend, braid, and coordinate multiple public and private funding sources in order to build the most robust ecosystem of services and supports that we can for children, youth, and families, and those who are serving and supporting them, so that are the most transparent, the most accessible, the most organized. And so there are multiple ways to approach this work of shared financing. And We have, again, a number of those resources in the guide, as well as examples and some charts and graphs that actually Mike Lombardo is going to present about how to approach this work of integrated financing across our agencies in order to maximize utilization of all of our resources and provide the most robust ecosystem we can by, for, and with our communities. Shared outcomes so that dollars support children, youth, and families when and how they need it across education, behavioral health, healthcare, child welfare, and juvenile justice. In California, we have significant reform happening right now that is designed for us to better integrate our financing together. And so we have a lot of that in the guide, and I'm really excited to be able to discuss this work because I think it is transformational and really the work of the future. Okay, next slide. What is continuous quality improvement? When we talk about continuous quality improvement, we talk about a structured, ongoing, really a cycle of inquiry in order to improve our systems and the development of an ecosystem that is united in service and supports for children and families. And I always say those serving them because it is easier for those of us trying to support them if our systems are coordinated and coherent and integrated. But we have to, in doing this work, be constantly thinking about this cycle of inquiry, this continuous quality improvement or community quality improvement, where the most impacted help define quality, help give us feedback on how it's going for them, whether they are better able to receive the services and supports that they want and need, and that empower them as well to be both part of the leadership, as we talk about in chapter 2, of our ecosystems, but here, part of our analysis of, is it working? Are we actually really realizing the goals that we want and need for children and families, and that they want and need for themselves? And the only way to do that is to have a continuous quality improvement cycle of work so that we're doing this ongoing inquiry. And we do this now. We do this now in our systems. This is about doing it together. Next slide. In the next slide, we talk about ongoing community-defined data ethics and information sharing. And one of the things that we outline in the guide is that we have to be thinking about this in both the macro and the micro. So at the macro level, and we do talk about this in chapter 2 as well in the development of dashboards in our counties and communities, in the macro data analysis, we're really looking at aggregated de-identified data for planning and for quality improvement and control. Think of public-facing dashboards or internal interagency dashboards and intercommunity dashboards where we really analyze the impact of our collective work in our counties and communities. And we are able to really analyze together equity monitoring and how we are supporting all children and families. And then we have microdata, which is equally important and governed by a different set of laws and regulations that we talk about in chapter 4. This is really individual, think about case level data for care coordination, being able to share information across our agencies and our communities for care coordination in a safe way that is designed to better enable us to support those that we are working to support, and so that they don't have to tell their story multiple times to multiple agencies, but they can tell it once. And we've care coordinated the system so that we can see what we need to see in order to best serve and support them. This area of work includes analysis of when you need releases of information, when you need consent to share information. There are entire bodies of law around individual information sharing for young people and their families. And we have a lot of that in the guide in chapter 4. And one of the things that we really want you thinking about in all of this is really family voice and choice in what is shared and transparency around what is shared. Next slide. Ongoing reciprocal accountability is aligned with what I just mentioned. This looks like cross-agency outcomes, indicators, and dashboards, which we also discuss building a shared dashboard with mission, vision, goals, and outcomes in chapter 2 that make performance visible with and for everyone involved, where we internally can see the progress that we're making and externally can present that information to in our counties and our communities so that we can hold ourselves mutually accountable between systems and the public, and between funders and frontline partners. We all do want the same thing, which is better outcomes by, for, and with our young people and their families. And this is a way for us to collectively join forces to realize that. We need levels of metrics, whole child outcomes, system performance, and equity metrics. And as I mentioned, you can go to chapter 2 to look at more information around macro data sharing and dashboard development. And now we are going to get into the next section, which is the how. You can go to the next slide. So in the how, we were going to have Jason Willis here presenting, but I don't think that he's been able to make it. So I'm going to discuss the how in the guide. And so the how is really outlined in the guide around not only why are we doing this and what are we trying to achieve, but the intricacies of how do we build it? Because what we find is everyone agrees that they want to do this work. And we have, as we've mentioned in chapter 1, tons of legislation and policy and intention around better aligning, cohering, coordinating, integrating our systems. But it always really comes down to how do we do that at the local level? How do we do that on the ground? So you can go to the next slide. The principles that guide sustainability practice are incredibly important. Public resource leveraging strategies. So really thinking about our resources, our funds, as one portfolio to be aligned and not isolated pots that we are defending, but really figuring out how do we maximize all of these resources together, better together. A public dollar is everyone's dollar. We are stewards of these dollars and entrusted to utilize them to optimize the use of those investments by, for, and with our children and families and within and across our public serving institutions. And there are many examples of this. And Mike and Richard are Mike and Peter and Humboldt are gonna talk about their work. 3, continuous improvement, information sharing, and reciprocal accountability are really the fuel to the engine of integrated financing. We have to have these processes in order to really analyze the efficacy of our work on an ongoing basis and in order to realize these shared financing principles and strategies for sustainability. Next slide. How does an interagency leadership team accomplish integrated financing? And again, this is all in the guide, but you need to begin by agreeing upon resourcing design roles and know each other's sector's funding drivers. Get into, as we talk about in chapter 1, and as the pilot counties in Transforming Together are modeling, interagency leadership teams where we begin to really understand the funding drivers for our various agencies so that we can begin to coordinate that. And I've seen countless examples of the power of this by putting people in a room to talk about the financing drivers and funding drivers that they have and how those can be matched or braided or blended to build the most robust system possible in our counties and in our communities. 2, build an ecosystem revenue map directly linked to the strategies that will be sustained. Co-design a work plan for sustainability. Design and document revenue allocations to your strategies. Formalize integrated financing, both the intention and the operational design in legal agreements with your partners. Together, build long-range forecasts, including agreed upon joint pursuit, which comes back to Chapter 1 and Chapter 2, building a leadership team, and setting your mission, your vision, and your goals. Next slide. This slide and the next couple of other slides are an example of a number of the integrated financing resources that are in the guide in Chapter 4. There are a lot of resources in the guide designed to enable you to do this work with steps towards implementation. And so we wanted to be sure to make you aware of these resources. You can go to the next slide. Here we have a sustainability practice self-assessment tool, which is just, we wanted to let you know an example of a tool in the guide that can be utilized in every single one of our webinars and in the chapters. We have tools that can be used for purposes of doing this work on the ground. And so we wanted to give you just a screenshot of this sustainability practice assessment tool. Next slide. Here we have also in the guide integrated care characteristics and sources of public funding chart. And Mike is also going to show some of the resources that he's developed, which will also be in the guide, with relation to how to identify the funding sources that are available and what they are available for, who is holding them, and how those can then be integrated into your goals out in the field and into sustainability planning for shared funding and to realize shared outcomes and a shared service array, universal service array, which we outlined and talked about developing in Chapter 3. Next slide. How does an interagency leadership team establish continuous quality improvement or community continuous quality improvement? You have to co-define quality with your youth and families. You have to establish feedback and learning routines. We have to link continuous quality improvement directly to our budget and our workforce decisions. And that's where this guide is so helpful, because we do go through building your shared leadership, your mission, your vision, your goals and objectives, your universal array of services and supports that you want to be able to make available, transparent, and accessible, your workforce development, and here, your sustainability, and looking at that financing and funding that you're going to utilize to maximize that array and these services and supports out in your communities. And you also want to make your continuous quality improvement visible and safe. Next slide. How do we build ongoing community-defined data ethics and information sharing? And it is really important that we are, as I mentioned earlier, transparent about information sharing that's happening. So number one, you can simplify and standardize your macro de-identified data sharing, both for internal dashboard development and analysis and external dashboards in your communities. And you can also really simplify and standardize your micro, like individual case information sharing processes. I'm going to talk about a resource that I was a part of developing that enables us to navigate HIPAA and FERPA for case information sharing. One of the things that I will say is on the micro data sharing, it is absolutely possible for us to better share information in a transparent, responsible way for children and families, but it does take thought and care and time to design. And once we design it, we have these processes in place, and then we can continue to utilize them together across our agencies and communities into the future. Two, you want to implement privacy respecting data infrastructure, and it is absolutely possible to do this. Again, very intentional work, but you can do this by, for, and with your counties out in the field, and many of you are already working on it. We have steps and resources in the guide that can assist you. You want to build ongoing community data practices, which we've already talked about in shared dashboards and also in transparency about individual case information sharing so that everyone is aware of what is being shared and how it is being utilized in order to improve services, supports, and outcomes by, for, and with those we serve. You can move to slide 29. This is also in the guide, but it is just a outline for a timeline for designing sustainable dashboards and data infrastructure. This takes intention. You need your shared leadership team working on this and your advisory committee, your executive advisory committee that's implementing your integration work in the field. But you want to design before you build, or if you have already built, you want to analyze what you are holding now. You want to build equity and privacy into your structures. And for the macro information, we are always allowing for disaggregation of information as well. We want to plan for real world sustainability. So what are realistic update schedules for our data sharing practices? How do we go about analyzing their efficacy and updating them on a regular basis? And then how do we maintain transparency over time? And again, lots of tools in this guide to do this work. And there are others in the field as well. Next slide. One of the tools that I want to mention is the HIPAA-FERPA toolkit that the Health and Human Services Department published this past year, and we have been training on in the field. It is an excellent resource for being able to really educate people on what is HIPAA, what is FERPA, and what happens when you put health information sharing and education information sharing together, which we are doing as we cohere, unite, and integrate our service delivery systems in school-based and school-linked continuums by, for, and with our communities. So this toolkit is one that you can use to train in the field. It's one that you can use to better understand whether you are an expert working on all of this or whether you are someone who's new to it. It does have scenarios in it that you can utilize to really understand the intricacies of information sharing practices for identified information for children and youth in the field across school health partnerships. So this is linked in the guide, and also the link to it is here. There's also information around information sharing in the 2083 System of Care MOUs that we've included in the guide, and in the Integrated Core Practice Manual that we also have linked in the guide. Be mindful when we're talking about information sharing that de-identified data sharing differs from identified information sharing, and we really, really need to think about building processes for both, and we need to think about those bodies of work. They are connected, but separately, because there are different rules and regulations that apply to both, and we need to be very thoughtful about the development here. Next slide. So we have the why do this, why sustain together. What are the factors that we're considering and bodies of work in enabling that sustainability. How do we go about realizing that sustainability? And what we want to spend time now doing is really talking about the work on the ground and what Humboldt County is doing. So I want to thank them for being here. I'm going to let everyone introduce themselves. And I know they're all together, which is super exciting, at least for me. So I'm going to turn it over to Mike Lombardo to take it from here, and then we're going to have questions at the end. Thanks so much.
Thank you, Elizabeth. Here we are, session 4. They went by really fast. I was telling my colleagues here that they're all available online to review. It is such a great pleasure today to be here with Peter Stahl and Marlene from Humboldt County Office of Education. I'm going to scoot over a little so you all can get the impact of how excited we are. We dressed alike for today's presentation. So all kidding aside, I'm actually up here in Humboldt County for their integrated leadership meeting that happened last night. We get together with the county leaders once a month to propel forward Humboldt's vision for children and families. In doing that, we're going to dive a little deeper for Humboldt here and look at the Bridges to Wellness program and what the journey Humboldt County's been on to get to today. We're also going to look at some other resources that are available. Jameen, can you help me out and do the next slide, please? So here's a graphic of braided funding. Well, some of these are what Humboldt used, like Behavioral Health Services Act, or back then it was Mental Health Services Act, to implement the Bridges to Wellness program that you're going to hear about. I wanted to include multiple funding streams. So Elizabeth talked real eloquently about braided funding. And here's an opportunity if we're looking at school-based integrated mental health funding to look at a variety of funding sources. And I'm not going to get into each of these, and it's certainly not an exhaustive list, to help support and move forward the work that we're doing for children with the goal of coordinated resources, aligned strategies, as Elizabeth mentioned, for those outcomes for children and families and youth. Next slide, Jameen. So now we're going a little bit deeper. To do braided funding, we really need to have a governance structure. So in Humboldt County, they had an alignment and planning team. This team, Peter will talk more about, was across multiple agencies. But I wanted to give you a visual of what it could look like for a variety of funding streams with a variety of agencies. So the alignment and planning team was coordinating and planning across the funding sources to help support Bridges to Wellness. So on the left-hand side, you'll see some all the funding streams, but I put BHSA and BHSSA, Behavioral Health Services Act, and Behavioral Health Student Services Act. They're towards the left-hand bottom of the graphic. While they're there, Humboldt, as they move into this next stage of sustainability, are going to start looking at and are now using the employer support grant. So we've shifted the braid, right, from Mental Health Services Act, which became Behavioral Health Services Act, to BHSA, and now the employer support grant, and soon to CYBHI fee schedule. Hopefully community schools we can look at, maybe even MA and FFPSA. So you start getting the idea of the iterations of funding. And Jameen, if you go to the next graphic, will blow everybody's mind. So now, the big reveal is braided funding streams on the left, and these are all potential funding streams for integrating their mental health services. Well, right now, they're focused on employer support grant. we're going to be working with Marlene and Peter to look at the enhanced care management, ECM, utilizing and leveraging the CYBHI fee schedule, potentially even community schools or LCFF. Excuse me. But to do all that, I want you to think about who are the key partners involved in each of these streams that need to be at the table. Second, what's the governance structure necessary to be in place when we think about utilizing funds that are across multiple agencies in support of our collective vision in your county for kids? And then how do we work together to make that happen for our kids and families? I can say over the years, I've worked with Humboldt looking at bridges to wellness, and they've done an exciting job at being, I would say, early adopters and integrating funding strategies with their behavioral health department. Unfortunately, they're traveling today, so they couldn't be here, but have done an exceptional job with behavioral health and other agencies to launch Bridges to Wellness. And now we're using these other funding strategies to look at how can we adapt that. Turn it over to Peter if you want to move forward to me. One more slide. There you go. Okay.
Thank you so much. It's really wonderful to be here with you all today. And as Mike said, I'm also here with Marlene Resholo, who's our programmatic funding analyst, and really, the heart of a lot of this work that we're doing to integrate our funding and work across our agencies. But so a little bit, this is just, the overview for some of you that are out there, sort of like, what is this Humboldt Bridges project and what does that entail? It was 2018 when our county, and when I say county, our Department of Health and Human Services were able to receive what was called a triage grant. This was a state grant. I think there are about 7 awardees in the state. Yeah. And so at this point, what we were really looking to do is to create an integrated school-based mental health program. This is, when Prop 63 was at its height, and our superintendents are saying we need more services in our school for mental health. I could go over the demographics of Humboldt County, but I will say that we're rural, we're very impacted by poverty, and many things. So this program that was funded originally through the MHSSA was really based on that shared commitment. As it said, we knew that we needed to do something. What was interesting when that first evolved, that grant, as many of you know, those MHSSA grants, they went through our Department of Health and Human Services. So each individual district, of which at that time we had 36, now we have 32 districts and 14 charters in our rural county. They hired, the individual districts hired regionally within the region, south, north, central, as well as the eastern part of the county up on our tribal lands, hired student service navigators and family support coordinators that work directly with mental health clinicians. We were able to roll and sustain this program with MHSSA funds after the triage grant ended, and we continued with that work. Around 2024 is when that grant sunset, and so this was, we were having many meetings with our advisory team. Just to let you know, our advisory team included county. We invited tribes. We had school districts present to talk about this program and the evolution and where we were headed. And the conversation at that point was around how are we going to sustain this program when the grant funds ran out. Fortunately and serendipitously, the Children's Youth Behavioral Health Initiative launched, and we were able to leverage some funds through some grant funding streams, which I think are on the next slide. So let's move it to that. Yes. So with this, what we were able to, with the MHSOAC, which is now the BHSOAC, the Behavioral Health Oversight and Accountability Commission, they were one of the CYBHA funded entities that were leveraging one of the grants, and our grants was for evidence-based practice and early intervention grant, which was our round 5 grant. So we were able to obtain that grant and then able to receive the workforce development grant, which is called through the
Employer support.
HCI, the employer support HCI grant. And at that point, everything shifted. So what saved it, and I wrote down something here that I just want to share. It was the vision that withstood the pause, because we had to lay off the student service navigators, which was a challenge because we didn't have the funds to maintain those positions, but we were able to secure those grants, continue the partnership, build agreements, and say, okay, let's relaunch this. But now what we're going to do is we're going to hire certified wellness coaches to assume the role as the student service navigators. So we were able to do that, and instead of districts hiring those wellness coaches, we hired those as a COE and reinstated with not that long of a pause. Keep in mind that the Department of Health and Human Services was continuing to take referrals on the behavioral health side. So it's not that everything fell out, but we didn't have the embedded service that existed in the schools. And what we really wanted to do is to retool it from a triage grant to really look at multi-tiered system of supports with an emphasis on preventative activities, so low-level interventions. And as many of you know that are on this call, this aligns perfectly with the vision of the certified wellness coaches. So we're able to do that. We're still reliant on grants to fund these positions, and Marlene could certainly elaborate. We spend hours talking about what our next steps are going to be. So, some on the call, and I don't want to go down too big of a rabbit hole, but I think this is important because when we talk about relationships and the work that we do across our agencies, some of you are probably familiar with the SB-HIP work, the Student Behavioral Health Incentive Program, which really was one of the first initiatives out of the CYBHI that helped us start to understand what this landscape was going to look like. But the unique thing that happened there is it paired us with our managed care plan. And in the North State, that's Partnership Healthcare. And through the work that we did with them, with the assessment and the project plans and all the work that we needed to do to obtain those seed funds, really to do those projects in the schools and start to build this system. Through one of those meetings, Mark Buttigieg, who's when our lead, connected with our foster homeless and said, "Hey, there's this thing called ECM." I remember sitting in the grocery store parking lot and calling Mike because it's about relationships and saying, let's talk ECM. What is this about? And how does this affect school-based service? So now we're one of, I think, 3 COEs that's fully online with ECM. And what this allows us to do is this allows us to reach more foster homeless students with case management and plans towards success and preventative plans with ECM. So one, the most importantly, more students are getting service, but we're able to work with those wellness coaches and leverage those supports in those regionalized settings. So we're going to bill for ECM, we're going to be billing on the fee schedule, and hopefully braiding those funds towards sustainability. So that's our ultimate goal. I know I've kind of gone off on the story here a little bit. So it's right there that on that bullet there. So, our certified wellness coaches, they're moving towards sustainability, and we're continuing the relationship with behavioral health. They work very closely with our staff. We have clinical meetings, we had our administrative meetings, and we're actually drafting a new MOU in partnership with them.
You added a new partnership health plan.
And we've added partnership.
So the braid is getting stronger.
Right. That's bigger. Right. Yes. So next slide. Okay. So, so the funding in some ways, when we talk about braided funding, I think it's interesting because when we're doing our ILT work and we talk about shared fiscal responsibility between agencies, that's one opportunity of braided funding that in some ways is more complex because it moves across those organizations. But I also want to highlight that part of Marlene's position is funded through our Department of Health and Human Services through some of the final MHSSA funds that we have. We have some prevention and early intervention funds that help fund part of our school climate team that are doing targeted interventions across our districts. So, we talk about the opportunities to share this funding. There's a perfect example of us doing that. And we also have visions in the future of having co-located services, tribal members, and Department of Health and Human Services all under one roof. Working together in our rural county. So, our opportunities to align education and behavioral funding streams are there. We want to scale up these supports and we want to look at these opportunities. I'm going to also highlight, as I wind down here a bit, I want to highlight the importance of relationship and communication across these lines. Michael had mentioned that our partner is traveling right now and isn't able to, our partner, who's the director of behavioral health in Humboldt County. She and I met at the California Mental Health Advocates for Children of Youth Conference, which is actually where I met Mike for the first time. And I remember us sitting there years ago, this is probably 15 years ago, and we weren't in the positions that we were in now. But I said, I'm not education and you're not the Department of Health and Human Services. We both work for organizations. We're trying to move this work forward. We need to break down this. There was a lot of tension and it was built, it's all based on funding. So how is it that we can start to vision things in a different way? So that relationship has carried these things. But the most important thing is that through these relationships, we systematize through agreements and through procedures so that when Emmy and I move forward, that these opportunities continue. So I'll end there and we will take any questions.
Do you want to jump into the question specifically in the chat that's for Humboldt, Megan, or Elizabeth?
Hi. Yeah, we have this next slide. Everyone can just, presenters can come off mute or off on screen. But sorry. One of the things that we wanted people to be reflecting on after all of this presentation and as they work on this and utilize the guide and other resources in the field is like what's one concrete action your team could take in the next 3 to 6 months to really think about strengthening your sustainability? What routines could become part of your system's ongoing culture? And then as a question for today, of course, beyond reflection questions is, what are your questions? What questions do you have given all of this material that we just presented? We're well aware it is a lot of information and a lot of different bodies of work, all really important and necessary. And so we're happy to take the time now to answer people's questions in the Q&A or otherwise.
So there's one here for Humboldt. Maybe Peter could answer what the impact was on children with the wellness. Well, they were called something else first before
For the student service navigators. So we have very rich data that shows not only the referrals were made, but the resources that families accessed. At first, the student service navigators were they were housed in our family resource centers, which we have across the county. So they worked closely around things like housing insecurities, food needs, mental health referrals, as well as recreation and vocational. So there was a lot of referrals happening. We tracked the referrals and we tracked, who actually connected with clinicians. And so, and the number, they're staggering. I don't have them in front of me. I'd be happy to send those out because we have those. But what we knew was that if this service was to stop, that there would be a gateway of connections for these students and families in schools that would no longer be there. Essentially, to use the metaphor, the bridge would no longer be operable. So it can be very challenging for families to connect to clinical services as well as other types of social services in our county. So to have those folks helping make those connections are really important in our schools, and we're really committed to continue that work. What we really are hoping to do is once we can, build that sustainable model and know that this can be done through ECM and the fee schedule and perhaps other funding sources, then what we can do is we can build this out, because there's many districts that are saying we would like a wellness coach, at our site as well. So we have to have a proof of concept, and then we plan on building that.
Along those lines, Peter, there's another question in the chat specific for Humboldt. Working with our managed care plan is new for the person who posed the question. When you say collaboration, what does that actually mean to you with the managed care plan?
Well, that's a good question. We do a lot of work across the state right now. We have a mental health collaborative that really was born out of our SBHIP process that's run by Paul Richmond, who's a consultant with our managed care. And we have presented several times about our journey as a county office working with managed care. I know that all of those experiences are not the same because the managed cares are different across the state. But what we are doing is we are working with other county offices to share the process, and we're building a guide, an ECM guide, so that it could really take a step-by-step process through everything that needs to be done from the work that we have to do with legal around our agreements and information sharing, to how we bill and the various portals and trainings around that. And the other thing is there's other community members that are doing managed care as well. Managed care is sort of a hot button item right now in service delivery. So we are starting a consortium of managed care providers in the county so that we can communicate around what are our intentions and the populations that we're going to be serving, so that we can refer and that they know that our service is there as well, so that we're communicating around that instead of competing as much as it feels like it feel like. As far as collaborating with them, we do have to call and email quite a bit sometimes because they are a big organization and system, but we have found that they've been responsive and they've helped walk us through this process. And we're excited because we just in this past month submitted our first course of billing for them. So we're excited to see what happens with that.
Nice. We'll shift to dashboards in a second. I want to let Peter talk about how parents and youth have been involved in Humboldt.
That's a great question. So parents and youth, to what aspect, I would say, I think, on our ILT, that's a conversation that we've been having, and we don't have that voice there yet. Although with all of the work that we do with PBIS and MTSS, it is an absolute goal that we're including student voice. We also received another grant through the MHSOAC before it was the BHSOAC for student advocacy around mental health. And we've leveraged those funds to build an advisory group of students across our schools that do projects through their wellness centers, and they become student leaders. And so we listen to what they have to say. And then they're also part of a belonging conference that's going to be happening in the middle of June here in Humboldt County. So we work closely with students. There's also a student advisory group right now that our superintendent has started, and they're going to have a panel discussion next week, and we're inviting agencies to that. So we're always looking at ways to cultivate student voice as far as their leadership in the ins and outs of what we're talking today. I don't know how much that's guided because we're just really looking at funds and placement. But our wellness coaches are with students every day. So that the need guides our service. The other thing that we do in Humboldt County is we coordinate a lot of crisis response across our tribal entities, across our agencies, and when we do that, we spend a lot of time with students and listening to what it is their needs are, and then shift our practice according to that. So
I think turn it over to Elizabeth to field some of these data dashboard questions. The first one was, are there existing data dashboards you encourage us to use? What should our measurable goals be? Any thoughts on that, Elizabeth?
Yeah, so we have some examples of existing data dashboards, county dashboards, external facing dashboards in the guide in chapter 2. So I would suggest going to that to take a look at that. And as far as what your measurable goals should be, I think one of the things that we emphasize is that's really a decision that should be made at the local level. Mike, I don't know in your ILT work if you have any suggestions there, and I know you came from Placer, where system of care is been running for a very long time, and I've heard Mike say many times, safe at home, in school, and out of trouble. But exactly what does that mean in a dashboard needs to be determined at the local level. And but I will say, with technology, where technology is today, I'm seeing an explosion and an evolution of capacities to really build shared information dashboards that enable you to really analyze, both, the efficacy of your system's ecosystem work and its impact, as well as build like much more accessibility and transparency around service arrays and support arrays that are available. So it's really an exciting time, I think, to be doing this. But that's what I would say. And Mike, I don't know if you have anything to add on that. These questions are awesome, by the way. You guys
they are great. And I think this is a few questions in one. When we think about this work that we're launching into and really evolving into, the most important thing for me and teams that are embarking on this work or already doing this work is to think about what our mission and vision is, and then link those to key performance indicators. So are we collecting data and reporting out for the sake of doing it? Or is our key performance indicators, our data, linked to our vision? And what's the process that you use within your ILT meeting, your integrated leadership team meeting, or your executive action committee? There's so many different names for executive action committees, but I think you all know what I mean. That team that makes things happen for the ILT. How does that team looking at data? How are we using data? How are we making decisions to improve outcomes towards that mission for kids and families? I see a question here. Which aspects of interagency data sharing what proved most challenging? What proves most challenging sometimes is when we start to get down into the grassroots and children data is involved, child-specific data. Then we need to start navigating HIPAA and FERPA. But if we're looking at grass top data, the big metrics, Much easier to navigate for the ILT because that's not child-specific data. Both are equally as important. And I think there's ways in MOUs and ways to share grassroots data. If you look at our HIPAA FERPA guidance. Peter, Jim.
No, I saw on Michael's question there, on Michael Butler's question, it says, and how did you overcome them? And we haven't. Yeah, so that, I mean, that really is, but it's the commitment is there, and I like what Michael's saying. Where's the data that maybe circumvents some of the that HIPAA FERPA alignment? Because what we would really love to do is just have that integrated data system, and everybody wants that. But we're looking toward what does that look like, and how are we going to set those agreements, and get the technical assistance that we need. And I think it's important as these things fold out across the county, similar to the sustainable funding models that we would talk to Fresno, and we would talk to Monterey, and we would talk to various counties to see what they were doing. We need to share this information across our counties. So if somebody actually has a platform that's working well, we need to share that out.
I feel like sometimes to Michael and the rest of you that these teams get stuck on, once we start talking about data, immediately the mindset goes to child-specific data. And I don't think that's necessary to move the system forward. So don't get stuck in figuring out the MOUs and everything necessary for child-specific data when your ILT and your integrated work can move forward with the GRASS top data while you do that other part.
Yeah. And Mike, I'll just jump in there as a long-standing attorney across systems and children's systems in California. That individual identified case information sharing does require a lot of navigation of a lot of various laws. However, those laws do contemplate that we share information within the confines of various parameters. Sometimes it requires a consent to release that information. Sometimes it does not. And we find when we ask for consent, we most often receive that consent. But I think the barrier that I've faced the most in the system and really trying at the micro level to case coordinate for complex youth who are touching multiple systems is people's immediate reaction being, we cannot do that. But actually that's not what is in the law, in the construct of the law. It actually does contemplate that we share. It's just how do we go about operationalizing that? So I think one of the barriers that I see is just intention and commitment, like Peter is saying, to the work. And then you can really build the operational processes. I have yet to have a situation where we haven't figured out across various entities, lawyers, people involved, how to share. We can figure it out if that's our intention. But it is complex and it does take time.
Any other questions jump out at you, Elizabeth or Peter?
Well, there's so many great questions here. So,
I know. I see.
I'm like, can we just I want to write answers to all these questions. Okay. So without getting into drama, were there or are there certain partners who are reluctant to contribute financially to a shared goal of supporting student support navigators? How did you steer people to see the value of that approach? When you say relationships matter, are those relationships across the leaders or the line teams? I really love this sort of.
No, I mean that's a wonderful question, and I do know this is going to be on YouTube, so I don't think I'm going to say the agencies. No, that's a joke. But but the fact of the matter is, I think what's challenging in this work, just if we take the long view, is that agencies and school systems, we are all struggling to maintain our own internal structures. So fiscal solvency in and of itself is a silo builder. And it's very important to start looking at the little examples that are happening. The fact that Marlene's position has been funded across these agencies, the fact that we've been able to, create a collaborative model where some folks are hired here, some folks are hired here, but we're one team and we're working as a collective. I think, you really need to reassure that what we're not here to do is we're not here to deconstruct each other's fiscal systems, but we're here to tighten the net of support in a community so that there's more people that are being caught and that we're not working without the knowledge of what's going on with each other. So there's the social capital and the knowledge of what each other is doing. And that itself is a fiscal investment without even talking about the dollars behind those things. So I know that it circumvents the question a little bit, but I think there's always protection when we're looking across our agencies, or how are we going to sustain the employees that we have and continue doing the work that we're doing. The bigger question is, how can we enrich in that work through that relationship, and where are the opportunities to start sharing those funds? So I feel like we've done that already. We're not fully integrated, but we are in a very cooperative stance and are open to ideas. So again, sort of like the data systems, we need to share those success stories and say, this works, you should try it, and build on those.
I'll just add, going back to your mission and your vision for children in your county. So all decisions should be centered around that. This isn't my agency's dollars. Technically, it's the people's dollar. And we're here to support children and families. And I think if we center on what your collective vision is for your ILT, that helps. It also helps when you start to peel back the onion, so to speak, with these dollars and the requirements that the state has put on them. You actually start to find new and innovative ways to leverage more in between and cross departments than you would if we were stuck in our silo, not putting that money on the table, so to speak, and really peeling back. How can we make these dollars work best for children to sustain the outcomes in our mission and vision? And that's a different mindset. It comes to a mindset shift sometimes where we haven't necessarily exercise those muscles as much as we need to.
And I just curious, as you do that and really shift that mindset and do the work, and you're talking about unlocking capacities for, braiding and blending or maximizing resources across the agencies. Does that, like, the question here is, how did you steer people to see the value of the approach? Does that unlock a value proposition for people? Like, oh, wait a second, now that we are together and we're talking about, can you give a concrete example? I think of like $40 or, other possible funding streams.
So I'm not going to speak directly for the commission, but the first triage grants that came out that led to BHSSA, ultimately Behavioral Health Student Services Act legislation. So those first triage grants were intentional to cause collaboration. So that funding went to behavioral health departments with a requirement of collaborating with education or other agencies to achieve those outcomes. And so, that's a way to start exercising those muscles, because to do that, like, there's a lot of systems that need to be in place to make that happen, and MOUs that need to be in place to make that happen. So I think, as the triage grant came out, and then ultimately 17 counties wasn't enough, there was so much excitement across the state, they expanded it in legislation to nearly every county receive Behavioral Health Services Act dollars, with the intention of causing that collaboration. And now, we've iterated again. So you saw the requirements in the Student Behavioral Health Initiative and CYBHI were for collaborations between managed care plans and education and other partners. And that probably is singularly one of the biggest changes, or caused one of the biggest adaptive changes. A lot of us didn't managed care what? We didn't know who they were until the system moved that forward. And now, the employer support grant, as you heard Peter talk about, as well as the fee schedule. And the fee schedule is really a robust opportunity to look at integrated funding across multiple agencies, including our community partners or tribes. Here in Humboldt, the tribe is looking at using the fee schedule, Two Feathers Tribe to be specific. And so it causes these opportunities. So those, I think, are good examples of what we talked about and showed in those illustrations. How do we use the strands of all those dollars? Because frankly, none of them are good enough. And some of you are probably thinking that, yeah, Mike, well, the fee schedule is not going to pay for our wellness coaches. You're right. It's not going to pay for all of them. You're going to need to braid that with ECM or other dollars, Families First Prevention Services Act. And so I just, in one sentence, talked about four or five agencies that are required to do this. And we can do that and do it well for kids. If we don't do that, I think staying in our silos really disadvantages us. Sorry, Elizabeth, that was more than you wanted.
No, that was great. Embedded in that question was, when you talk about relationship, are you talking about the leaders of the counties, or are you talking about the people on the ground doing the work? Like who needs to have these sort of like integrated, aligned relationships? Everybody, all cheers.
Well, it's interesting because I do think that middle management, we have relationships with each other a lot because we are actively working together with our crisis responses, with our mental health referrals, with all of our programs. We're constantly working together. And so I think what's really nice about the ILT is it's able to showcase the work that we're doing and bring our superintendent, bring our directors together to really start having this conversation that I think aligns with the desire that we've had for years to say, really, how can we bring this together? And so I think all of the above are really important. Go have coffee with that person that works in that other agency and develop those understandings with each other and start looking for ways to work together. I think that is really, it may sound simple, but I think it leads to really complex problems and opportunity.
If you have really strong relationships at the middle level or on the ground, how necessary do you think it is that we also have that at like the senior agency level to really building this out?
It's critical, because it is really through their direction and and a shared vision. So I kind of look at us as sort of the engine and they're the steering wheel or something like that. I don't know, but it really does sort of help guide. I know that the more that I engage the superintendent and other people do within our organization, the more informed he is when he's sitting and part of the ILT essentially. So
I wrote in the chat, the ILT or the executive leaders create the hospitable environment to make this happen.
That's right.
So without leadership actively engaged, it can be really hard to make integrated systems happen, because ultimately it's their authority to steer or braid fund.
And there's an analogy I think it's important, because I know that there's educators on this call, and I think when we think about like positive behavior intervention supports, when we think about tiered systems in schools, the two things that really help systems change, that in the research, the two variables that are most impactful are administrative leadership and access to meaningful data. And those are the two things we've talked about in this conversation today. So if the leaders are thinking, oh, this is going to bubble up because there's so much enthusiasm below me, so this is just going to happen organically in some way, that's a faulty perception. Like the leaders have to sort of understand where that, what that is and be committed to it. Otherwise, I don't think that we're going to see the systems change that we desire.
All right, we have 3 questions in 6 minutes. Has Humboldt created a shared dashboard?
No.
Are you all working on that, or what? Like, just curious what you're.
It's a journey.
Again, it's a journey. It's something that we'd like. I mean, we share data that we have, but we do not have a shared dashboard at this point. But that is certainly something that that's on the table.
Yeah, that's the conversation of the ILT. That's the importance of bringing those leaders together. One of those key features you'll see, and I'm not good with what chapter it's in, I think it's chapter 2. One of the key features you'll see is key performance indicators and data use. And so that's the journey of the ILT. And if you're an established leadership team, to revisit that data set. What's the second
it's
question,
chapter 2.
Elizabeth?
Okay, next one. What are your lessons learned on sustainable governance in the context of cross referrals, care coordination, and data sharing?
A lot to unpack there.
I'll give you 2 minutes.
Maybe, if we're thinking of cross referrals, and I might get this wrong because how I look at the question might be different than others, but that's that child or youth who crosses multiple systems. And so at that point, I think it's critical to have either end, child and family team in, and care services coordinating teams in place, cost teams, so that we can look across the system and collectively support that child using each of our expertise and strategy, aka funding sources. And so I don't know if I answered that quite right, but I did it under 2 minutes.
The lesson learned is that we all know that when we see examples of this happening, that we see better student outcomes.
Yes.
And so, we talk about the data sharing and how we're striving for something better, although we do share our data. Our care coordination, we're lucky because we're a county where we have the relationship. So our care coordination, we have our student study teams, we have our child intervention teams that are multi-agency. So child welfare is there, probation's there, mental health is there, the schools are there, we're having conversations. So, I mean, when those things are well coordinated, we see us wrapping around our students. So the lesson learned is keep creating the communication.
Yeah, and just as somebody who worked a lot on the ground to build that as well, operationalize that, I would just say my lesson learned is that you really do need the commitment of agency leadership in order to do that care coordination effectively, because you need a clear understanding of which agency is responsible for what services and supports for young people and their families. And sometimes we don't have clarity on that. And when we don't have clarity on that, the young person gets caught amidst that lack of clarity. So we need to have very clear understanding of the roles of the agencies, particularly where we have potential overlap. And then we need to be doing our care coordination. So that just needs to be, something that is really supported by agency leadership. So where it isn't clear, you build clarity, and then your care coordinators at the local level, at your cost teams and your ILTs can really figure it out. Or maybe you have some question at the ILT or cost team level, and they take that up to the interagency leadership structure so that can get clarified, and you can build a more robust pathway for that youth, which that youth always represents a population of youth. It's never just one student or child. So the last question was peer-to-peer. How does peer-to-peer fit into this. And we have 1 minute. Any thoughts on peer-to-peer support?
You see the value. I don't really, within education, we don't have a specific grant through the CYBHI for that peer-to-peer support, although we have a wonderful transitional age youth partnership that exists in our county. And so that TAPE program provides a lot of peer-to-peer support. So I think that the concept is there. We need to build that out. We talk about peer-to-peer a lot around the group of mental health advocates that we've been working with, and where are the opportunities so that they can take even more of a leadership in their wellness centers and in their communities. So anyway, I leave it at that.
I'll add, and Elizabeth, you know this because you're going to be talking about it tomorrow with me on the Child and Family Policy Institute webinar, a focus on youth and family involvement in the system. So we'll be talking about that as well as conflict resolution. And I guess I just gave a shameless plug for the CFPIC webinar tomorrow, if you're available.
Yeah, I think it's called the Community of Learning and Practice, if you want to look at the CFPIC. We will be talking more about that, and chapter 2, we have a whole section on really meaningfully embedding families and youth in our ecosystem building. Okay, I thank you so much for answering all these questions and for asking all these questions. Are phenomenal, and appreciate everyone for participating and being here. And I'm going to turn it over to James to close us out in the last 4 minutes.
Thank you, Elizabeth, and thank you to Humboldt for the insight of great work happening there, as well as Mike, who's always great and so informative. Jameen, can we go to the next slide? Certainly want to ask folks to complete the webinar series feedback. Megan just put the link into the chat. And again, as you're completing it, just please take a moment to reflect on what would be most helpful to support your ecosystem and building efforts moving forward as we continue this work. And again, just in Jameen, go to the next slide. In just thanking our presenters, our Humboldt partners, Mike, Elizabeth, again for facilitating and coordinating these webinars. Breckenridge, certainly appreciate you from San Bernardino County Superintendent of Schools. And then also just our partnership with Sohill and CYBHI. Certainly appreciate all of you guys and all the partnerships. And lastly, just as we close, I just want to emphasize that sustainability is not a one-time strategy, right? It's what we've heard. It's a way of operating over time. And for most systems, the next steps isn't doing everything. It's really identifying one concrete action that you can take into the next 3 to 6 months. That might look like starting a shared budget conversation, establishing a continuous quality routine, or beginning to align data practices across systems. But the key is making sustainability part of how your system works and not an add-on to the system, right? And just and finally, I like to leave you with, we've talked about leadership, we've talked about alignment, we've talked about service delivery, and now sustainability. And at the end of the day, this work is about whether systems can show up consistently for our children and our families. Because again, families do not experience systems in phases. They experience whether support is there when they need it, right? So again, we appreciate you all being here and being a part of this work and continuing to push forward. Thank you all and have a good rest of your day.